Every day, improvements in medical technology enhance the quality and longevity of human life. The same can be said of animals, especially horses. As a result of tremendous advancements in equine medicine within the last decade, horses from the barnyard to the winner's circle are proving to be hardier, healthier animals. Diamond is a 6-year-old mare who recently gave birth. During the delivery, Diamond suffered a fairly common injury which will require surgery to repair. Veterinarian Dr. Byron Reid, an equine medicine specialist in South Florida, explains her condition.
She's been diagnosed with a 3rd-degree perineal laceration, and that occurs at foaling, where the foal, as it presents, basically puts a foot from the vagina into the rectum, and as the mare pushes and expels the foal, it tears the whole shelf between the rectum and the vulva.
Dr. Reid and his staff at Reid and Associates outside of West Palm Beach have been providing veterinary services for over 20 years and have seen vast improvements in surgical techniques.
The techniques are being developed all the time. They're changing, they're being modified and improved, and people are reporting on them, so that we're finding the better ways to do all the procedures we used to do. We've got better ways to do many of them now because of the advances that are being made.
Reid and Associates provides a wide variety of services for its equine patients, including arthroscopy, laparoscopy, soft tissue surgery, orthopedic surgery, and much more. Dr. Reid and his staff pay meticulous attention to detail and place the emphasis on the safety of the patient.
I can't prepare a treatment plan without the proper diagnosis, so first I'm going to go through everything I need to get a diagnosis, such as ultrasound, x-rays, a good physical exam, figure out where the problem is, and then you have to decide if it can be treated medically or surgically.
As a surgical practice, the advances in anesthesia technology are certainly important. Diagnostic capabilities have increased. Ultrasound, for instance, was non-existent 20 years ago. Now it's taken for granted. Radiology, X-ray technology's improved. Now there's a lot of digital available. We're able to take much better images than we used to take.
Great strides have been made in equine medicine over the past 20 to 30 years, which have had significant impact on outcomes. Colic, for example, has a vastly improved survival rate when referred and operated on early. Most colic losses are not because of complications of anesthesia or surgery, but are complications of the disease which are drastically reduced by early surgical intervention. Dr. Reid says it's important to recognize the signs that could indicate colic.
Horses normally have a borderline ravenous appetite all the time. So at feeding time, if a horse refuses to eat, there's something wrong. Colic's a very common reason for that, but the earliest sign would be refusal of a meal. That's when you should call the vet, actually. For whatever reason the horse is refusing to eat, if it's a serious case of colic, signs will progress to pawing, glancing or even staring at the abdomen, lying down and getting up. It progresses possibly to even violently lying down, rolling, to violently throwing themselves down and being unable to stay still. That's sort of a progression of the severity of colic signs. So the first sign might just be, that's noticed by an owner, not wanting to eat an offered meal of hay or grain.
Reid and Associates is utilizing the latest technology and techniques to provide a higher level of service and efficiency of healthcare to its equine patients. For more information, contact Reid and Associates today.